Hello and welcome to another mental health podcast, which today we are going to be looking at the subject of psychosis and what that is and what that could mean to you. My name is Steve. I'm a mental health nurse here in the Gloucester Royal Hospital Mental Health Liaison Team, and I am accompanied today by my colleagues.
I'm Charmain. I'm a social worker within the Mental Health Liaison Team.
And I'm Katie. I'm a Lived Experience Practitioner in the Mental Health Liaison Team.
Okay, and so let's start with looking at what is psychosis. My understanding is generally speaking, we see people who are starting to have a really different view of reality to what everybody else may perceive, and that can be quite distressing, can't it? When they're starting to think, hear, or see, or have certain thoughts that aren't real and start to become a bit unsure about what's going on there.
Yeah.
Yeah. What do you think about that? Do you, generally speaking, it's a really worrying thing for people, isn't it? Really, really scary.
It can be. It's because, like you've identified, it's a loss of contact with reality, isn't it? And you can experience hallucinations and delusions. A lot of disorganised thinking and thoughts can be going on all at the same time. So it can be quite upsetting and distressing for that person who's experiencing that.
Yeah. No, I agree. And psychosis as well, I suppose it's important to say, in terms of a diagnosis, psychosis is normally a symptom of other mental health concerns. And so if people start to become psychotic and have those phenomena going on, we as professionals are immediately thinking, well, what's the cause of that and what's the trigger?
Yeah.
Isn't it?
So it can happen. So you can have a period of psychosis with bipolar, can't you?
Yeah.
On our previous video, we spoke about that.
Yeah.
You can also have a period of psychosis with schizophrenia.
Yeah.
Can't you? Or you can have substance-related psychosis.
Yeah.
Or you can even experience psychosis during a period of pregnancy.
Yeah. And also, as well, it ties in with our delirium video. Because there are lots of people, both young and old, who might become delirious that can start to have psychotic phenomena, can't they, as part of that.
Should we talk about some of the symptoms?
Yeah.
So delusions are fixed beliefs about reality that other experiences show cannot be true. So if you experience delusions, it's natural for them to feel completely real to you when you're experiencing them. You can feel as if your thoughts and feelings and behaviours are being controlled, or that they've been replaced or removed by an external force. Quite often you feel unwell, or there is something wrong within your side, within your body, or with your loved ones, or with family members. So you can be quite fixated on being unwell, or that there is something else going on for family. You can feel like you're very powerful and that you can control things. So I know when we spoke about delusions before, we spoke about, walking out into traffic feeling like you can control the cars, or that you have some external force controlling you. You may also believe that you're in a relationship with a celebrity. So if you're into Love Island or anything like that, you might believe that you're in a relationship with somebody who's prominent in TV or in media.
Okay, so that was about delusions. I suppose it would also be good to look a bit more about the hallucinations that come along or could come along with psychosis as well. So that's all about hearing voices that other people don't hear, or seeing people or faces that other people can't. So that could include seeing people's faces, seeing animals. Some people see religious figures. So these are all things that can happen if you're experiencing psychosis or having hallucinations. And also there can be different sorts of hallucinations which affect your sense of taste or smell, and other sensations which I don't think that they're generally speaking as common, but you do come across people with different taste and smell sensations which are always something which we would look into.
So when we're talking about, these delusions and the hearing of voices, quite often we encounter ones who are experiencing this. They can be quite suspicious, can't they, and paranoid.
Yeah.
So it can be quite difficult to build up that trusting relationship between ourselves and the person who's experiencing that period of psychosis because of what's going on for them internally. So we might not be aware. They might not be, so if they are hearing voices, they might not be responding to them, but they might be, like me and you were having a conversation now, if you weren't there, it would be evident, wouldn't it, to other people that something's, but it's not always like that, is it, when somebody's experienced a period of psychosis? They could be wandering off with a fixed stare, couldn't they?
Yeah.
And that's evident that they might be responding to something, couldn't they?
Yeah.
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 Or if you're talking to someone, it might become obvious that they're responding to a voice in the room which isn't there.
Yeah.
So it's
They
not
could be
always
quite
the case.
distracted, looking around, couldn't they? And wandering around and yeah. So it can be, sometimes it can be difficult to get that. And I know, because we're in a hospital setting, we kind of want that individual to keep still, be seated, be in that bed space.
Yeah.
But obviously, if they've got all these things going on for them inside their head, it can be quite difficult or quite tricky, can't it?
It really can.
Especially if they're of a belief that we're trying to hurt them or harm them, or we've got a hidden agenda. So there's a number of things when we're supporting that, when we're supporting an individual who's experiencing that we might need to do.
Yeah.
Yeah.
Yeah. No,
Yeah.
I think that's
And that
the
is
thing.
something we're going to look at in a few minutes when we speak to Katie, won't it?
Yeah.
Yeah.
But in that hospital setting, I think that's a really good thing to do, to actually think about how difficult that is to manage someone who has got all of this going on, and thinking, well, how can we approach them where we can reassure them and obviously listen to what they're going through in a way which is going to be well received.
Yeah.
You
So
don't
what do
make
we do,
anything
Steve,
worse.
when we encounter somebody who's experiencing a period of distress and upset? How do we support them?
I think it's really important to approach people like in a calm way.
Yep.
And listen to them before you try and actually do anything.
Yep.
Get a really good understanding of what they're going through, what thoughts are they having. Because obviously this, like you've said, is really real to them.
Yes, it is, yeah.
And in order to communicate with someone, you need to get a really good understanding of
We
that.
do, yeah.
And
So even our body language, it's simple, isn't it? Simple things like our body language.
Yeah.
We kind of need to be relaxed.
Yeah, don't be threatening.
Don't be threatening, no. Show our hands maybe, because if don't have our arms folded or hands in pockets. We need to have a relaxed posture, because if they are suspicious, they might think that we have something in our hands to harm them.
And a huge mistake is sometimes you will see people being dismissed, won't you?
Yeah.
As if to say, look, what you're saying isn't making any sense.
Yeah.
And just dismiss that in a way which is obviously a really negative thing.
Yeah.
And that, I think that often is going to make the person going through this feel much worse.
Yeah. They might not even know they're in a hospital environment, even explaining to them that they're in a hospital, they're in a safe place.
Or they might then think you're an imposter.
Yeah,
or
they
something.
might do.
And,
Yeah.
And so then anything positive that you want to try and do to help that person, you've immediately blown it, haven't you, really? Which is not going to help you moving things forward. Listening is the key thing here, isn't it? Listening to someone, understanding where they're coming from, taking it seriously and not dismissing them.
Yeah. But I suppose we're going to go on to what that speech might look like, because it might be difficult to understand or gain. They might not be communicative.
Yeah.
So it might be difficult to listen to what that individual's talking about, what they're saying, because it might not make much sense to us, but it's very real to them.
Yeah.
So, yeah.
Yeah.
Should we look at what disorganised speech might look like?
I think that's a good thing to move on to, because frequently that's what you will see, isn't it? Disorganised thoughts and disorganised speech, because what we would call racing thoughts are really common, aren't they? Where you're trying to talk to someone, but during that period of time, they've gone from one subject to another subject to another subject. And that can make it really difficult, because you need to slow it down, don't you?
Yeah.
And when you're trying to help someone, I think you might think you're discussing one thing, whereas that person's already like 100 yards down the road, aren't they?
They are, yeah.
And that is something we would call a flight of ideas.
Yeah.
And that, you know, flight of ideas, racing thoughts is very difficult to keep up with, especially when you're trying to build a rapport with someone and try and sort of get on the level and have some understanding there.
But also, when it's disorganised, they might not make any sense. So the words might not have any meaning to us, but they might have a meaning to that person who's experiencing that.
Yeah.
So again, as you mentioned, it's not to dismiss any of that. It's always trying to keep that individual informed of what's going on around them,
Yeah.
who we are.
Yeah.
Yeah.
And I think when you've got that pressure of speech, sometimes if you've got the right approach and you talk slowly, because obviously their mind is going at that 100 mile an hour.
Yeah.
But if you talk slowly and make people realise that you're safe.
Yeah, and you might have to repeat that a number of times.
You might do.
Yeah.
And it might be something where initially just to reassure someone and make them feel safe is as good as you're going to get it. And then slowly with time you can start moving forwards once you've got a bit more rapport and trust between you both.
Yeah, which we do understand. It can be difficult in an emergency department.
It really can.
Because everybody's really busy and it's not. They have a number of patients in there. It can be quite tricky to do if you're having to.
Really tricky because everybody. It's an emergency department, isn't it? So everybody is sort of racing around. People are coming in, but all of that aside, this is a patient that really needs time and understanding, isn't it?
Yeah.
Okay, so I think we've covered it. Disorganised. We could do a whole podcast on disorganised thought and speech, couldn't we? But
we could, yeah.
That's the gist of things.
So considering all of the different factors that we've just discussed, somebody presenting in the emergency department experiencing acute psychosis might feel like quite a high risk situation for staff. In reality, what sort of risks would you associate with somebody in that situation?
Yeah, you're right, Katie. When we have encountered situations like this, it does elicit quite a response of that person being deemed as a high risk. I think it's often to do with the way that person might be presenting. So they can, like we've discussed, they can be quite unable to keep still, the rapid speech.
So would the risk primarily be to themselves as opposed to other members of staff or other people in the department?
So you'll actually find the risk to others is actually quite low. I think it's because that person's in a very vulnerable state. So that's the risk that could be looking at the most, because they have a certain level of fixed ideas of that time or beliefs. So they might actually be putting themselves in a very vulnerable or very risky situation because it's what's real to them at that period of time. But risk to others statistically is very, very low. Risk-taking behaviours or self-harm to themselves is increased because they might have those fixed beliefs or ideas at that period of time. So psychosis doesn't define a person. Like we've discussed, you can have periods of psychosis, but it's just one part of a person's story. And with the right support and understanding, you can go on to live and lead fulfilling lives.
Yep.
And you're a perfect example of that, aren't you, Katie?
Yep. So I'm here in my capacity as Lived Experience Practitioner, but also as somebody who has experienced periods of psychosis. And we thought it might be helpful if I answered some questions from the perspective of someone who's lived it.
Yeah. So can we just start off with, can you describe what you were feeling in the days or weeks leading up to your period of unwellness?
So I developed postnatal psychosis. So I didn't really have a lead up. I was pregnant, had my baby, and then became unwell quite rapidly. And I think it's really hard to differentiate between what is the effect of having had a baby and developing postnatal depression and postnatal psychosis.
Did that period happen in hospital or did you go home?
I think I started to feel unwell at home. I didn't recognise that I was unwell, but others did. Talking to other people who've experienced psychosis, they talked about their thoughts speeding up prior to becoming really unwell. They found it very difficult to focus. They found the world really confusing. So those are some of the things that people have told me about from their own experiences. And
that's an important thing to recognise, isn't it? That it is a very confusing time.
Yeah.
Isn't it? Yeah.
It's also very personal, so
Yeah.
every individual will have a slightly different experience of psychosis, even though there are certain common threads that run through most people's experiences.
And we spoke a lot about changes with sleep and things like that. Did you notice any changes with your sleep at that time?
Yeah.
Or energy?
Yeah, I suppose it's hard. I was looking after a new baby, but I didn't feel I needed to sleep. I was really busy cleaning through the night, looking after baby. I thought I had absolutely nailed parenthood. It turned out that I was really unwell.
And then, did you realise something was wrong?
I didn't feel good. I felt very wound up. Things that shouldn't make me anxious made me really worried. And the world started to not make sense anymore. And people I trusted didn't feel as trustworthy anymore. What people were telling me didn't match my reality. I don't think I'd have pinned it down and said I was unwell. I just thought the world wasn't making sense anymore, and it became a really scary and unpleasant place to be.
And when you look back at that time, can you remember what kind of support you received?
I received really good support.
Okay.
I had support from GP surgery, from midwife, and quite quickly mental health services got involved, so I had support from the crisis team. But I think the person that made the most difference was my husband, because of all the people that were kind of coming in and out of my life, he was a consistent presence, and he was someone that, although I couldn't quite trust him in the moment, I knew I used to.
Yeah.
So he had the best chance of communicating with me and kind of helping me to understand what was happening.
And when you look at the individuals that you've supported in this role as well, how do you recognise give us any tips or pointers on how would be good at supporting them during a period of psychosis?
So if we think specifically about emergency department, lots of staff, lots of things going on, an awful lot of input for even someone who's actually mentally well. So I suppose one of the key things would be trying to give that person space in a quiet environment, if that's possible.
And that is not easy, is it, in
no.
the emergency department?
No.
It's not easy, but using one of the interview rooms just to reduce the amount of information that's flowing past that person. If it's possible to have some consistency with the staff that are having contact with that person, I found there were people that I could trust more easily, that I could build a rapport with, and other people for probably a completely irrational reason, colour of their uniform or something they said, as far as I was concerned, were really risky.
Yeah.
And so being able to maybe remove people that aren't being able to build that rapport and focusing on those that can, that could be really helpful.
And as you've spoken about, it is different for everybody.
Yes.
Even though there are similarities.
Yeah.
Yeah, so I know as well, don't we, Steve, that sometimes having, like Katie's spoken about, having a lot of staff there, but like having a lot, especially for delusions that are about police or security, it's not always best to have a lot of those people present at that time, but we do understand it's an emergency department and it is quite chaotic and hectic in that regard. But
So I was terrified that I'd done something very wrong.
and that's what,
And any time I saw any police, I thought they were there for me.
Yeah, yeah.
They weren't.
Yeah.
They were there for something completely different. But my assumption was it was there for me. It heightened my anxiety and then made it much harder for me to cope in that environment. And I think as soon as staff understood that, they made every effort to protect me from seeing the police, so that I didn't get elevated and escalated in me for no reason.
And then can I just ask, what has helped you the most during your recovery?
I'd say during recovery, it has been returning to normal life and rebuilding the things that have meaning to me. So spending time with my daughter, going back to work, having a structure in my day. Medication played a role. I had some really amazing support in a mother and baby unit, and I had ongoing professional support after I was discharged. But I would say the thing that keeps me well is having a normal, structured, meaningful life.
So, Katie, we have been looking at your journey, but can we just look at what it might be like for an individual coming into the emergency department and what the emergency department can be like at those times? Because we know they're very, very busy.
Yep. So I spent a little bit of time thinking about sort of four key elements of someone's journey that might be challenging for staff and really challenging for that person. So shall I go through those?
Yes, please. Yeah.
So the first thing is we've talked a lot about the person having anxiety-provoking thoughts. They may be hearing voices, they might be seeing things, they might have beliefs that don't match with the reality that everyone else is seeing. And that is absolutely terrifying when the world doesn't make sense to you anymore. And I've always found it really helpful when someone reassures me but doesn't dismiss what I'm experiencing. So like Steve was saying earlier, if what I'm saying doesn't make sense or isn't likely to be true, trying to argue with me isn't going to get you anywhere, because that is my reality, so don't bother. But what you can do is say, gosh, that sounds really distressing. Is there anything I can do to help you in that situation? So rather than arguing with me, acknowledging where I am and meeting me in that place has always been really helpful. My husband's very good at doing that. He says he'll never collude with me, but he also doesn't argue. So another, I think, a challenging situation can be when an individual feels the need to do something and they feel the need to get up and walk around the department, and that can feel quite disruptive. I've experienced people stopping me, and that tends to just escalate the situation, because right now that is the most important thing that I need to do, and I need to do it now. And the fact that you're stopping me is really going to distress me. So if it's possible, and I know it isn't always possible, but walking with the person, maybe redirecting them, minimising the chaos, but not necessarily expecting them to sit down in a single place, because that might just be not achievable for that person in that moment. We talked about it being really hard to trust people. Everyone around you is trying to describe a reality that isn't yours, and that makes it really hard to build a relationship with someone.
You mentioned not colluding with somebody, but I know when we've had somebody who's been in the department who's been quite fearful of name badges.
Yes.
So we simply removed our name badges. It wasn't, but that was enough to help support that person during that period of time.
Yeah, I mean, I think colluding is more when you are reinforcing someone's delusion by saying, yes, you know, that the police are here for you.
Yeah.
That's not going to help them. But equally, arguing that the police aren't here isn't going to win you the battle either. It's just about trying to avoid the person seeing the police. So it's being creative and finding alternative routes rather than meeting the person head on and having a battle. It's about trying to find another way that that works for you and works for them. Hearing people talking outside the cubicle is a big problem. If you're already hearing voices and you're already worried that people are conspiring against you, if you hear people talking about you, that really reinforces that you are right.
Or talking about you in front of you as well.
Yes,
That can also feed into those feelings of suspicion and paranoia, can't they?
And the difficulty building trust, I think it's really important that staff recognise it's nothing personal. You might not have done anything wrong. It's just simply that in that moment, you are not someone that person can trust in their slightly altered reality. And the final thing is communication. I remember either my brain was working so fast, I couldn't stop long enough to answer someone's question, or sometimes it feels like you're walking through treacle, it's really slow and you can't find the words, and that's incredibly frustrating. And I think the only answer to that is patience, and somebody sitting and waiting while you find that word, not rushing you and trying to put words into your mouth for you, but really just having that genuine patience and making it feel okay, because the more anxious you get, the harder those words are to find. So those would be the four things that I think anybody working with somebody who's experiencing psychosis needs to know and can do just to make that journey a little bit less terrifying and a little bit less overwhelming. So I hope that's helpful.
No, it really is. You know, and we're always at the end of the phone, aren't we? You can always call our office, and we can support in any way.
Well, thank you very much for sharing that with us as well.
Okay.
And thank you to everyone who's either watched or listened to this podcast. And we hope that you come back and join us on others. So thank you very much.